Okay, we're back for our fourth and final round with Supervisor Mike Wasserman regarding some questions, especially pertaining to COVID-19. And Supervisor, again, thanks for being with us. The question I have for you now is, if essential businesses are able to follow certain protocols and be considered safe, is there a reason other businesses who follow those same protocols cannot also be considered safe?
Mark, that's an interesting question. Yes, they can be considered safe, but, that's the but, okay? What the public health officer is trying to do, and as I've expressed in a couple of your prior sections, you know, think of her like a fire marshal at a burned down building. Her number one concern is safety. Number one concern is safety before people go into the building, before reconstruction starts, in any of the above. So the first phase in her program has been what they considered essential. Essential was getting food, getting medical supplies, the Walgreens, the Safeways, things like that, hardware stores for repairs. I replaced both traps in my sink, my bathroom sinks during this break. So that was essential, and she's come out with, okay, essential businesses, you can be open, hospitals, etc., under these protocols. Wearing a mask, wearing a shield, 6 feet apart, gloves, all of those kinds of things, minimizing the number of people in a particular room at the same time. So essential businesses, you can do that, and let's try and flatten the curve while essential businesses are allowed to operate and the rest of us are sheltering in place or sheltering in home. Now we're starting to enter this phase, federally, nationally, statewide, and our county, where I think we're going to see more businesses starting to be allowed to be reopened. Businesses that were considered non-essential before. And the reason right now, Mark, non-essential businesses, by having them closed at this time or sheltering in home, minimizes the chances, even if you're wearing a mask and gloves and stay 6 feet apart, from contact. Because the reality is, as you and I talked about, people at the farmer's market, people at the restaurants, etc., not everybody wears a mask right now. Not everybody wears gloves. We've heard that the droplets from this virus can survive 2 to 3 days on a hard surface. So your question was, if these safety protocols work for essential businesses, would they not work for non-essential? I will answer, they would work as much for non-essential as they are for essential. However, the public health officer is trying to limit the number of people out there. And when and if and as she releases various individuals and businesses to resume work, they're going to have these safety protocols in place to minimize the chances of contracting the virus. Again, all of this is to minimize the chance of contracting a virus that we do not know is going to go away or not. We do know that, God, from our samples, something like 3 or 4% of the people have it right now. I've heard people have written me, Mark, and said, only 3 or 4% have it, then let us out. Other people have written me and said, 3 or 4% have it, oh my God, keep us sheltered in home. 97% of us can still get it. So it depends if you're looking at a cup half full or half empty on how soon. And what's going to happen is the business part of our society and the medical part of our society, I think, are each going to give a little bit as we make sure we don't overwhelm our hospitals and we make sure we don't destroy our economy and all businesses, and they each give a little. My hope, and it's my hope, and again, I'm not speaking for the public health officer, who I cannot, nor can the Board of Supervisors, is that very soon we will see businesses which can operate with their business people, their employees, at a safe distance, and do so with masks on. I think that is coming, and then I'm hoping when that's happened for a few weeks, that the results are, hey, we did that responsibly. Let's let more businesses follow suit, and let's continue doing this. But until there's a cure, Mark, there's not. And until we know there's a season, this is a new normal. This is the problem we're in.
Exactly right. And obviously we can't shut down the economy until that cure is discovered. Otherwise we'll have nothing to open up. And with that being said, Mike, should the shelter in place order be extended beyond May 4th, businesses are going to be devastated. Is there something that we can do, anyway, that we can all do in order to lobby the county supervisors and or the governor in order to begin easing these restrictions?
You can all lobby away, and I will take the information you send me. Again, complaints, suggestions, whatever you got, send it my way. I will forward it on to the public health officer that makes the decision. You can certainly lobby your state elected officials, the governor. You can send information to all of them. But at the end of the day, because of the way our great nation is set up, the president can make a recommendation. The individual states have the authority to approve what they want to. The governors can issue an order. But then each of the 58 public health officials in the state of California can say, okay, implement the governor's order verbatim, word for word, as is, or do everything that he said, but where he said you can go back to work on the 10th, I'm saying the 15th. I'm just making up an example.
Sure.
Bottom line is the public health officer has the ability to implement what comes down from above and make it stricter if he or she wishes to. The public health officer cannot make it more lenient. So we currently have, and I say we, the County of Santa Clara, because our public health officer's order is different. It's the same as some counties, different from other counties. What pertains to us here in the 15 cities and the unincorporated area of Santa Clara County is what our public health officer's order reads. It currently deals with May 3rd, as you said. My guess is that shelter in home is going to be extended. But what my big concern is for businesses. Businesses are failing now after just 1 month of being the sheltered, closed, non-essential. Businesses are failing now. The only reason numerous people aren't being evicted now from lack of rent payment is because it's against the law to evict somebody from an apartment or a home because of their inability to pay, because they've been unemployed, laid off, self-employed because of COVID. So that's what's going on. I am a businessman. I have been, my father was, I always will be. And I totally understand what small and large businesses are going for. And I am lobbying daily through my own voice and that of the emails that I forward on to our public health office. I've also expressed my concerns to our assemblymen and our congress members. This is a health crisis. We are headed towards an economical catastrophe. This must be averted. We need to take some risks, and those risks are allowing businesses to resume to some sort of normalcy, hiring people, producing products, paying people, those people receiving money, spending money, generating taxes. We need to get our economy going again. And I will help convey that message to the public health officers. Our PHO works with 7 other counties in collaboration. The current order is set to expire, I believe it's next Monday. I expect another order to come out later this week. I do not know what's in it, nor can we write the order. But I certainly do hope there's the opening of the door for businesses that can operate in a safe manner to do so.
Likewise, and many of our businesses and members here feel the same way, that there's got to be a point. And I think it sometimes feels, I think, the sense of hopelessness for people who don't know when that date is. And you can say, well, we're going to extend to May 3rd,
yep,
but that could always be extended beyond. Or so I think that's what is challenging for a lot of people as well. But just the fact that businesses are unable to generate revenue, of course, is just crushing them. And even though you might have some deferment in your rent, you still have to pay that back, and you have 120 days to do so once that deferment order is lifted as well. So all of this, this stuff just piles up and piles up. And with no money coming in at some point, small businesses especially will find themselves facing whether or not to keep trying to go at it or just to file bankruptcy and move on.
Oh yeah, and the trickle effect, Mark, is huge. If the businesses don't reopen, they can't pay their employees. The employees then don't pay their landlords. The sales tax, even income tax on wages. Okay, that's the biggest source, for the state of California, is the income taxes and capital gains taxes. Ultimately, property taxes, Mark, if this prolongs, will go down because values of homes will go down. And that will affect our public school system. That will affect the money the counties and cities get. The trickle-down effect of businesses closing is totally devastating, and we need to start opening our businesses sooner than later.
Right. And Mike, as a businessman and position you're in now with the information you have, what advice would you give to a business who is looking to begin to prepare and plan for opening up when the shelter-in-place order is lifted?
To be prepared. When my daughter was first notified, my daughter's a hairstylist. When the order first came out, she had to call and cancel 141 appointments. There was a date on that first order. She rescheduled all of her clients to the day after and the following couple of weeks. She rescheduled them. A second order then came out. She had to call all of her clients again and reschedule them. She has rescheduled all of her clients starting May 4th, as have a number of other people that I know. And while I've been paying my house cleaner and my gardener not to work, I was fully hoping they would be back May 4th. I've now called them and said, that's not going to happen. That's not likely to happen. Perhaps landscapers will be in the group, that first group that is allowed to resume normal operations, because they can mow and blow with a mask on and not come within 25 or 50 feet, much less 6, of anybody else. Arborists going back to work. There's a number of businesses, Mark, that are currently considered non-essential that I firmly believe could come back, and this ties into your prior question, could come back completely safely, maintaining distance, not transferring the disease to anybody else, and produce income, earn income. That can happen. So for the businesses planning, we have May 4th. My guess, and this is a guess on whatever today's date is, April 27th. My guess is, I'll just say my hope. My hope is several businesses currently considered non-essential will be allowed to reopen. And those being businesses that can operate in a way where distance can be maintained between employees and customers. And I gave a few examples, such as the construction industry, such as gardeners, arborists, nurseries. They can limit the number of people at the nursery, limit the number of people on the site. They can do an infrared testing of their forehead when they arrive at work. They can do it again at noon. They can monitor this. But I don't personally think that certain businesses that have direct contact, for instance, Mark, you brought up restaurants earlier. I don't see restaurants reopening, certainly not at full capacity next week. Right now, the ABC is allowing them to sell alcohol, I'll say out the back door, with a purchase of bread or some meal. I'm hoping that the ABC extends that until all shelter in place has been removed. Because even if restaurants are allowed back, but it's at 50% occupancy, let's say they've got seating capacity for 60, and under the order that allows them to resume business, it has to be at 50%. They can only have seating capacity for 30 at a time. No restaurant I know can make money at half occupancy. So I hope the ABC, and I have lobbied our state representative, I hope the ABC will allow those restaurants that still will not be, until they're allowed full occupancy, will allow those restaurants to still sell alcohol out the back door, as that's a money-making part of restaurants. So all businesses, prepare to be reopened, but be realistic. Keep in contact with your clients. Make sure you've got whatever supplies that are not perishable in stock to produce whatever product you provide. One of my tenants was a florist. She was non-essential. She had to throw out her entire store of flowers. Anne has asked me, Mike, should I buy more flowers this week in preparation of opening May 4th? I said, no, don't do that. I don't know what businesses will be opened. I do know that more guidance and new order will come out, I assume, by the end of this week, because the current order expires next Monday. And I'm sorry for the uncertainty. I know uncertainty in business is horrible. People need to plan. But more than anything else, our businesses have to be allowed to reopen, to conduct business, and do so in a safe manner.
Exactly right. Thank you for that, Mike. Do you foresee, is it moving to a different topic, do you foresee any unintended consequences with the county's effort to reduce prison population and limit the intake of prisoners during this crisis?
Thank you, Mark. And if you'll excuse me 1 second, I don't know if your members can hear that or not, but I have a puppy growling in the background. Just 1 second. Come on in. Come on.
Those are your, not puppies, those are your coworkers.
These are my coworkers right here. I'm sitting here and I can hear her growling behind that door I have closed behind. So I didn't want to have that growling in the background. You remembers what was going on. I'm sorry, your question was about prisons?
Do you foresee any unintended consequences with the county's effort to reduce prison population and limit intake during this crisis?
Okay. I presume that would be one of your questions. A lot of people have written me about that, and I have some points here that I want to read directly from because of the detail in them. And it was a couple of weeks ago, the health department gave a favorable assessment. So they went to the prisons of how the jails have addressed the coronavirus, and we haven't seen any downside to date by reducing the jail population. Across the state, counties have released nonviolent pretrial detainees and people with expiring jail sentences. Bail has also been reduced for misdemeanors and low-level felonies to slow jail admissions. What that has meant is a 25% reduction in the jail population for Santa Clara County, compared to a 39% reduction in San Mateo and a 33% reduction in San Francisco. So far, our reduction of people in jail is less percentage-wise than both San Francisco and San Mateo, which I'm sure will make a lot of your members and listeners feel better. In our county, and this was a week ago, 9 jail deputies and 2 civilian staff members and 2 inmates have been infected with the COVID virus. So far, we are doing it right. We have reduced our jail population because those people in jail do not have the ability that you and I have, Mark, when we're out and about or go somewhere to stand 6 feet in line if you go into Walgreens, or 6 feet in line, 6 feet apart in line at Home Depot. They have much more proximity. And so people are being tested, temperatures are being taken, and the procedures being taken that have been reviewed and approved by our health department are working, and there has not been any notable adverse effect in crime in the public from the release of those individuals.
And Mike, does the county collect that data from the local PDs?
I'm sorry, arrest information goes to the county, and of course, all people sometimes forget, Mark, each of the individual cities have their own PDs or they have a contract with the county sheriff department. But at the end of the day, there's only one jail, and that's county jail. We have 2 or 3 jails, but there's one county jail. So when I refer to people being in jail or let out of jail, or number of people in jail, it's all regarding the county jail. And so yes, all information is being filtered through. Also, our liaison from the Emergency Operations Center is also tracking and working with law enforcement regarding these statistics, law enforcement and our jails.
Okay, just wondering, with that being the case, and obviously the local police departments know that the county is not taking additional inmates depending on the severity of the crime. In some of those cases, do they just not even, I mean, is it just sort of a ticket and let them go, or,
you mean the court system? That, the court system,
okay.
yeah, the court system, state of California, that's the judges that decide who goes in, who goes out. Yeah, the court system in general, and for the last several years, way pre-COVID, okay, was reducing reducing the number of people that go to jail. They've been doing that for years. That's been a system that's come from above, from the state of California. Mm-hmm. And they've been reducing the jail population because of the studies as far as the, people tend not to, jail's not a good place to get better. Jail's not a good place to learn a trade. Jail's not a good place to get a GED. So the state of California and the public safety system has all determined and given directions to the judges as far as not putting people in jail more than necessary. And they've released a great deal of people. Most recently, as I'm sure you're aware of, individuals that had marijuana violations on their record. Those were all expunged so that they don't have that on their record anymore and can get jobs. So it's just a different way of thinking as far as public safety. But the releasing of individuals or not putting as many individuals into jail is not a direct result of COVID. That's been going on for years. We have increased that where possible to try and minimize the contact between the inmates. But the people being released, it's agreed on between the DA and the public defender.
Okay. Well, thank you, Mike. Thank you for your time today. Really appreciate you taking your time out of your schedule. I know you're busy. We saw your one of your French bulldogs there. So on the lighter side, I know that you and your wife have 3 French bulldogs. How are you managing your work schedule from home?
Oh, Mark, this is about week 5. On Saturday, I took a couple of hours off. I have not worked less than 10 hours any one of the last 35 consecutive days in a row. I've had several 16-hour days, and I've gone from 7 in the morning till 11 p.m. working. My staff is working. The 100 to 150 people at our EOC, our Emergency Operations Centers, that is staffed and manned from people from County Council's office, from our Emergency Services office, from our County Exec's office. They do their 40-hour-a-week job, and then they go and put in shifts at our EOC, managing, administering. They have seen very, very little. So they put in their 40 hours. At least I'm sheltering in place. I've been in the office 3 or 4 days, but I'm sheltering in place. I'm here at home with my wife, who in another month will be 40 years with my wife, and my 3 dogs, as you mentioned. I'm doing that and I'm working. But the staff at the county managing the EOC department are doing their 40-hour job and then not coming home to their spouses, to their children, to their pets. They're going to the EOC office and putting in 2, 3 more 8-hour, they sleep there, Mark, shifts on and on and on. And it's been 5 weeks of this. And to some extent, we can expect several more weeks, some shelter in place extent. I'm hoping not anywhere near where we are right now. I hope it gradually decreases over time, but they're going to be there. And then there's all our public safety people and all our public health people. We are sheltering in our homes with our loved ones. Our public health people are administering to the thousands of people testing positive, the people in our hospitals. They're wearing gowns, they're wearing shields, they're doing all of this, but we still have way too many public health officials, public health employees, nurses, doctors, maintenance people contracting this disease as well. It's those people that are the real heroes. And any of us that can work from home, we are fortunate because we can continue to still earn a paycheck and do our job, and our risk of getting infected is very, very, very low. But it's the business owners, the members of your chamber, my daughter, my son last week, 1/3 of his publicly traded company was laid off last week. And the rest of them are taking 15 to 30% pay cuts. My daughter and her salon, all the stylists have been laid off and cannot collect money of any type. These individuals are in a world of hurt. These businesses, once they close, you can't just restart up again. That takes capital. And loans are not grants. But I can assure all of your members, the Gilroy Chamber that I belong to, the Morgan Hill Chamber that I belong to, in San Jose, and the Los Gatos Chamber that I belong to, all your emails coming to me, I'm forwarding on to my liaison, the liaison for the supervisors, your ideas, your concerns, your complaints, I'm forwarding on to them. And the public health officer and the public health office are listening. And they're working on a plan to get us out of this shelter in place in as safe a manner as possible. There is not an easy answer. We cannot shelter in place the way we are for many more weeks. Business will be devastated. Businesses will be destroyed. California, that's Peaches saying I'm out of here. California will be destroyed. Our nation will be destroyed. We need to get our businesses open again. And I'm doing all I can to help out in the way that I can.
Well, we appreciate that, Mike. And you mentioned a list of people who, you know, in any crisis, there are those who have to go above and beyond the call. You mentioned quite a few of them, and we're grateful to those who are doing all that they are and in order to try to keep us safe. Any final thoughts before we go, Mike?
Peach is quiet. Mark, my final thoughts are thank you to giving me this opportunity to speak specifically to your members in an audio video type way. I appreciate that. I want to encourage all of your members to hang in there. Things will get better. I know things are not moving as quickly as you would like. They're not moving as quickly as I would like. And when businesses start opening, the public health officer is going to be holding her breath that it doesn't get worse and it starts a surge and our hospitals get impacted and we got to go back to where we were. So hopefully this gradual release of businesses who enforce the safety protocols per our public health officer can show that they can operate, they can produce, they can manufacture, they can earn a living, they can pay their employees. They can do so in a safe manner. And our county and our state and our nation can start to return to normal and get there sooner than later, because we can't take much more of this. Thank you very much, Mark.
Thank you, Mike. Well, again, thank you, Mike, for your time today. We certainly appreciate that. We're going to be continuing our virtual legislative summit with other elected officials as well, as we have discussions with them coming up. Be on the lookout for that. Until then, I'm Mark Turner with the Gilroy Chamber of Commerce.
Thank you, Mark.